So what are the treatment options that we have available for hypertension? There's a variety of treatment options. Treating blood pressure is not necessarily meaning taking drugs alone. There are a lot of important lifestyle and dietary measures that we need to consider that will help reduce blood pressure as well. And I think the cornerstone of treatment is actually, before we even start any drugs, is to address the patient as a whole. We need to see which areas in their lifestyle and daily activities that can be modified to reduce their blood pressure. In particular, patients with high blood pressure will need to adjust their diet. They need to cut down the salt intake. I mean, sodium intake is important because the higher the salt intake, the higher is your blood pressure. So I think if you look at the sort of FDA recommendation for how much salt you should take less than 2 grams a day. And I think for most of us in Malaysia, for example, our diet, we're taking far too much salt. For example, even a curry bowl of laksa will have more than 2 grams of salt already. So plus your lunch, your dinner, your breakfast, and all the other stuff, we are taking far too much salt than our daily requirements. So by tackling this, cutting down salt, you can actually reduce your blood pressure by 5 to 10%. So I think it's important to look into our diet, reduce salt if necessary. The other aspect that we also need to do is alcohol consumption can also increase your blood pressure. So if you consume a vast amount of alcohol, this may be one good way of reducing your blood pressure, reducing the alcohol content. So look into the diet, reduce the salt, reduce alcohol consumption. Then lifestyle measure such as exercise is also very important. Regular exercises does relax the blood vessels and it does lead to a reduction in your blood pressure. Again, people who exercise regularly will experience a 5 to 10% reduction in their blood pressure over a long-term period. This is not unusual. If you see somebody going on a jog, they come back, they check their blood pressure after exercise, you will notice that their blood pressure usually comes down. So, simple measures such as this, dietary changes, exercise measures, can all help reduce your blood pressure by 5 to 10%. If you are overweight, also important, reducing weight. People who are obese, for example, if they reduce their weight, their blood pressure comes down. So weight reduction is another useful way of reducing your blood pressure. Apart from this, I think another factor that I've noticed a lot in our society these days is that people, especially in the cities, are often very busy with their daily lives. They don't have enough time for rest or sleep. Sleep deprivation is a major risk factor for hypertension, and I think if you do not get adequate rest or sleep, then your blood pressure tends to go up. So again, very important that you make sure that you have adequate amount of sleep. And how many hours is adequate does vary from person to person, but in general, most people would require, for the average adult, 6 to 8 hours of sleep a day. So I think if your blood pressure is high, you want to reduce it, you have got to make sure that these lifestyle measures are taken into account. Try to get enough sleep, adequate rest, exercise regularly, watch your diet. And for example, for those who are in high stress level jobs or occupations, it's important to take time out to distress yourself. This may be in the form of exercise is a good way of doing it, but also there are other ways, yoga, breathing exercises, picking up a hobby to take some time off work. I think these are important things to consider when you have high blood pressure. You need to modify these lifestyle changes. Now, all this can help reduce your blood pressure by about 10%. And for many people with stage 1 hypertension or mild high blood pressure, you may not need to take pills because these measures will reduce your blood pressure by more than 10% and get your blood pressure down to target below the treatment zone. On the other hand, if you have very high blood pressure, these measures may not be adequate and then therefore you would need to take medications. I will touch on medications in the next session and we will discuss about the different types of high blood pressure medicines then.
Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share and comment. Thank you.